Ontario Nurses Association have revealed that frontline healthcare heroes are suffering from a mental health crisis. 60% of nurses in long-term care are experiencing symptoms of PTSD. 67% of all nurses don't have adequate access to mental health supports. The stress of staff shortages, lack of PPE, burnout, low pay, and the tragedy of witnessing elders die alone are placing an unbearable burden on frontline heroes. Speaker, these heroes need support now, not 4 years from now. So will the Premier make a commitment to these heroes in tomorrow's budget to provide the increased funding for LTC staff this fiscal year and accelerate supports for funding mental health services?
Thank you. The Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you for that question. First off, I'd like to begin on behalf of our government, on behalf of all of us, thanking all our frontline workers for the incredible job they're doing, day in and day out, putting their own lives at risk, not knowing what's going to happen when they get home at night, and also looking after our most vulnerable, people in the hospitals, people in the long-term care homes, the PSWs. The list goes on and on and on. We recognized early on, Mr. Speaker, that there was a huge cost associated with the work that these individuals do each and every day. And as a result of that, we turned very quickly within the Roadmap to Wellness to create the supports, the virtual supports needed to help the individuals. We started off with internet-based cognitive behavioral therapy, which now is serving, between that and the other programs, over 62,000 people in the province of Ontario. And we specifically focused one program to help people that are our frontline workers. And at this point, Mr. Speaker, there are over 2,600 people that are taking advantage of those virtual services. But this is just the beginning of what we're doing for our frontline workers.
Thank you. And the supplementary question.
Speaker, with all due respect to the Associate Minister, the statistics contradict what that answer just said. And I also want to point out that our youth are also experiencing a mental health crisis. McMaster reports their eating disorder program increased admissions 90%. The number of youth in hospital for suicide attempts tripled. Sick kids, 25%.
Member of York Centre will come to order. I apologize to the member for Guelph.
Speaker, Sick Kids is reporting a 25% increase in youth seeking help. Speaker, the bottom line is everything is not okay. Soothing words will not solve the crisis. I'm asking the government to cancel things like Highway 413, get their priorities straight, and will they commit to providing $4 billion over 4 years in mental health funding instead of extending it over 10 years because the crisis is happening today?
Again, the Associate Minister.
Thank you, Mr. Speaker. When we talk about the pandemic, we have to remember that mental health was a concern in this province long before the pandemic came to us. We're in a situation now where we are doing and investing, the first time, by the way, an historic amount of $3.8 billion in the mental health and the well-being of individuals. Yes, it's being invested over 10 years, but let's stop for a moment.
I'm going to ask the Associate Minister to please take a seat. I'm going to ask you to stop the clock. I'm going to ask the member for York Centre one last time to come to order. Start the clock. The Associate Minister.
Thank you. We have to stop and ask ourselves, where did we start 3 years ago? And I can tell you for a fact, because I've been in this sector for over 10 years, we started with no system. You want to talk about broken? You want to talk about lack of access, fragmentation? Well, it existed everywhere. And our initial investments, the minute we got into government, was to start to build a system. And that system is going to take time to build. You cannot undo the lack of effort in 15 years in just 2 short years. We will fix this system, and we're focused on doing that as a government.
And the next question.